Welcome back to Mayo Clinic Radio. I'm Dr. Tom Shives.
And I'm Tracy McCray.
Millions of people need blood transfusions every year. Now, some may need blood during surgery, others depend on it after an accident, or because they have a disease that actually destroys their blood, or one of its components. Blood donation makes all of this possible. According to the American Red Cross, winter is one of the most difficult times of the year to collect enough blood products to meet patient needs. Busy holiday schedules, bad weather, and seasonal illnesses like the flu can affect donations considerably.
Sure. And that's why National Blood Donor Month, which has taken place each January since 1970, is such an important observance. And here to discuss the importance of blood donation is Medical Director of the Blood Donor Center at Mayo Clinic in Rochester, Minnesota, Dr. Justin Kreuter. Welcome back to the program, Dr. Kreuter. It's good to see you again.
Thanks. Pleasure to be back.
Thanks, Dr. Kreuter. So difficult time of the year for you.
Absolutely. For all those reasons that you just mentioned, people get sick with colds and flus that are going around. People are wanting to visit their relatives. And, when big snowstorms hit, people can't make it to the blood donor centers to actually give that blood.
I also maybe incorrectly assume that a lot of people who donate blood are retirees, and maybe they're down south. They're someplace nice and warm. Am I assuming that incorrectly? What does the population of blood donors look like?
Yeah, it's going to vary from program and what the location is. For example, here in Rochester, Minnesota, we do have an older cohort of donors, but that's going to vary. Although that said, I think nationally there certainly is a huge importance in younger donors, so donors in their 20s, 30s, and 40s, to give donation a chance. There's a lot of people that haven't even tried to donate blood. A lot of people also just assume that maybe they're ineligible. And really, eligibility is really going to be a local thing. You want to call your local blood donor center and find out if you're eligible and if you can come in and donate.
What are some of the things that would make you ineligible?
Yeah, broadly speaking, you really want to make sure that it's safe for somebody to donate blood. So we're really interested about medical conditions, especially somebody's heart. The cardiovascular system is connected and important. We're also going to be really focused on, is the blood safe for another person to receive? So if somebody is taking an antibiotic because they got a small infection that doesn't really bother them, we still don't want to collect that blood because there might be some bacteria then that would get in and be transferred to the patient. And as you know, some of our patients don't really have that strong of an immune system right now, and we could really be putting them at risk. So when we're looking at who's eligible to donate blood, it's, are you safe to donate blood? And then is your blood safe to give to a patient?
Any other contraindications other than you mentioned infection? Someone who's had a recent infection.
Yeah.
Who else might not be eligible?
Yeah, there's a whole list of what somebody is eligible or not eligible for. If you've had a recent heart attack, obviously, then we're concerned about your own personal health. Certain medications that a donor may be taking, like finasteride, because that donors should wait for about a month after taking their last dose, because that could be teratogenic for a
teratogenic.
So it could cause defects for a fetus if it was transfused to a mother who's pregnant.
Probably the better way to do it is, if you're unsure, try to donate blood. And there's all sorts of screening that happens before that ever occurs.
Absolutely. So, reach out, either call your blood donor program and ask them some of the questions where you think might put you maybe not eligible, and just see, or just show up. I mean, this is what we really live to do, is find out if somebody is eligible or not. Like you say, there's a whole list of regulations from the federal government, and then there's also going to be a whole list of local decisions being made by the medical director for that blood donor program. So, for example, the things where it really puts the blood at risk for the patient receiving it, those are going to be regulated by the federal government, whereas the medical decisions over is somebody safe to donate or not, their own medical situation, that's going to be determined by the medical director of the blood donor program.
How about a history of cancer? Can you still donate?
That's going to be variable based on what center you go to. So that's a great example of it, because that speaks to your own personal fitness for donating. So here at Mayo Clinic, for example, we let people donate if they've had a history of cancer after about 1 year for most cancers. Blood-borne cancers like leukemia and lymphoma, right now we're still deferring permanently or indefinitely, but that's going to be variable.
I'm going to live long enough so that someday you'll be able to say, yeah, we'll take your blood too, Tracy.
Well, that's what I'm hoping
You've
for.
been rejected?
Well,
because of
yeah,
the
because I
history
had
of
lymphoma.
Really?
It's been 30 years, but I'm going to stick it out. I swear.
I'm
And you're
gonna
the
write a
person
letter.
that we're targeting for.
That's good.
That's right. I'll see if I can get you in.
What happens to the blood after it's donated?
Yeah, so when you donate blood, we're going to take that donation, we're going to process it into a blood unit that gets transfused to a patient. So we do a little bit of manipulation in the back room. We also send off some testing for some of the common concerning infectious diseases like HIV, hepatitis B and C, and we wait for the infectious testing to come back. Once that's back and negative, then we can put a label on it and ship it out to the hospitals to use. So today is Friday. If somebody were to come in and donate blood, we would probably have it on the shelf for the hospital on Sunday.
Does the amount of blood that you need vary with the seasons? I mean, I would have thought, for example, that in Minnesota, where it's so cold in the winter and people aren't out and around as much, that you wouldn't need as much blood because not many accidents, for example. Does it vary by season?
It does. It varies by season. So we see peaks and valleys throughout the year. Some of it's predictable, but then on a day-to-day basis, there's also quite a lot of variability. And that kind of highlights that, sometimes tragedies can strike in our communities, either weather-related or otherwise. And it's really the people that came in and donated recently in the past few days that are going to have that blood on the shelf for the patients that are in need.
What's the shelf life of that blood?
So that's also going to be varying, but in general, red cells are good on the shelf for 42 days. Platelets are good on the shelf for 5 days. Plasma we can freeze for a full year. And so I guess how we monitor the inventory of blood, it's a little bit like having milk. I know Dr. Shives likes Raisin Bran for breakfast in the morning.
How'd you know that?
So I'm guessing you probably like to have milk with your Raisin Bran. So you like milk to be in your fridge, but you also don't like your milk curdled, I bet.
So just keep a lookout on that date, that expiration date.
Yeah, for sure. Yeah,
You can't
gotta
freeze
have
it.
milk on. Yeah.
You can't freeze blood though, huh? Just the plasma?
We can freeze red cells, but
Okay.
that is a very intensive process, and we also lose some of that blood product in the process. So we do that for rare blood units.
And how often can you donate? How long does it take you to recover between donations?
That's an excellent question. That really gets at something that the blood donor community we're wrestling with right now. So in the United States, you can donate every 8 weeks, but there's a real concern about preserving and protecting the iron stores of our blood donors. And so that's undergoing a lot of debate. We might see that changing in the future.
Longer or shorter?
For longer.
Longer.
Yeah.
I just have to say, and I know I've probably shared this in the past, but just as we referenced the lymphoma, when I was going through my treatment, I had to have a transfusion. And it is amazing how much better I felt just a few moments after that transfusion happened.
Is that
And
right?
so if anyone is listening and on the fence about whether they should donate or not, yes, for accidents, yes, for surgeries, but also, patients that need transfusions, it makes a huge difference, life-saving and just quality of life.
Recently I was at my daughter's school talking about blood donation, and it was wonderful to see the masterful teacher talk to the kids about, do you think that it hurts when you get a needle? And all the kids, oh yeah, and how long does that needle prick hurt for? And the kids are, it's a short period of time. And she said, do you think people that are sick in the hospital do you think they hurt? And the kids said, yeah. And they said, how long do you think they hurt for? A long time. Yeah. And it just kind of goes to show, I think there's a lot of people that have a fear of needles or they don't like the pain, but that little bit of pain that we take does result in a very meaningful and significant immediate difference for a patient in need.
Absolutely.
How old do you have to be to donate blood?
You
didn't get all those fifth graders into the blood donation center, did you?
No, but I'm hopefully making future blood donors
Good
out
for
of them.
you.
So you have to be at least 17, and in some states you can be 16. But again, that's another area where we're really particularly concerned about wanting to preserve the iron status of, in particular, our younger donors. So that's something that's what's on the books right now, but that might change in the future.
Well, it's Blood Donor Month. Thanks for helping us get the word out. And whoever donated that unit of blood for Tracy, you made her feel better.
That's right.
All right. Blood Donation Month with the medical director of the Blood Donor Center at Mayo Clinic in Rochester, Minnesota, Dr. Justin Kreuter. Thanks so much for being with us, Dr. Kreuter.
Thank you for having me.